Hello everybody, this is Tyson Kurna. I am part of group H1 for the elbow teeter videos. In our case was a 50-year-old with a Mason class 3 radial head fracture. So the technique or treatment I'm going to talk through today has to do with that class 3 radial head fracture, which is often a comminuted fracture, so the fragments are displaced. So most of the time it is treated with surgery, which then has a number of issues that occur after that with factors such as immobilization, because there is an immobilization period that must take place for the tissue to heal properly. So to treat that immobilization period, a technique in the article we looked at called TERT, total end range time, at the end of that contracture, or where that bone is kind of hitting that other bone. What we want to work on there with the TERT is putting it into that end range as far as it can go as a stretch without pain. And to do that, we're going to use a turnbuckle splint. And what that looks like, I can show you guys a picture. I'll link a picture along with that. You can see that in the teeter. But what this device does, it basically looks like it's from the upper arm to the lower arm, and there is a connecting bolt that goes between the two segments. And what there's a nut on the end. And how you use this is an orthotist will fit you for it and then get you put into one. And then the tension's really on the patient on how far they can go with it. So you're going to use a wrench, and they're going to tighten that nut until the arm straightens out to a point where they feel a stretch, but there's no pain. Times you would use this would be if physical therapy hasn't been working. I know there's an immobilization period, so giving therapy a chance. Doing some strengthening, other stretching exercises before that. If that hasn't worked, then this is often a treatment type that is used. Contraindications: if the fracture remains to be unstable or anything where putting a constant load or stress would cause further tissue damage to the elbow. So for this injury, it's it seemed very avoided in the literature, as a lot of clinicians have been using other techniques, trying to find other techniques to work, and this technique seemed to have pretty good evidence behind it. So once again, that end range stretching with the turnbuckle splint is how we are going to treat this patient to increase their functional range of motion, which in this study was from 30 degrees short of extension to 130 degrees of flexion. If you have any questions, please comment below. Thank you for watching.